AI assistants like transcription copilots and chatbots are yesterday's news. Now we're entering a new era of agentic AI. The new tools are powerful, but a little unsettling. AI giving advice is one thing, but are we ready for AI to take action on our behalf? Welcome to CareTalk, America's home for incisive debate about healthcare business and policy. I'm David Williams, president of Health Business Group.
And I'm John Driscoll, chairman of Yukon Health. David, do you think the AI is and the artificial intelligent robots are about to take over our lives? What are you getting at here?
Well, John, we've seen what kind of impact generative AI can make, but I understand that we are, moving quickly into the area of agentic AI, which goes
Well,
beyond
just
generative AI.
you consultants, you have all this confusing stuff. Okay, smarty pants, what is AI? Let's start with AI, Gen AI, and then agentic AI, so that we at least understand the wacky terms you're using. What is AI?
The part I could probably answer is I thought you'd say what's Gen Z? I could probably talk about that. I mean, so AI is artificial intelligence, and it's basically, like alien intelligence is another way to describe it. It's just some intelligence intelligent things that are being done by machines. And it used to be thought of as, okay, something that's kind of emulating a human, but it isn't necessarily, John. It's like an intelligence that's taking
You're
place
you're
outside
you're
of the
caught
person.
up in your sci-fi fantasy. Artificial intelligence is that intelligence that's basically comparable to big compute, large computers crunching lots of information, giving us information that is modeled historically like the way computers answer and ask questions, but at a speed and a reach using lots of data that is generally unheard of. It's the original version of AI is, can we create a computer that can think faster, smarter, better than a human? That comes from the late 50s when it was earlier set up, and it has really been beyond reach. And in the last few decades, with the advent of more computing power, more powerful chips, more access to data servers, and frankly, more standardized data, because the machines need historically standardized data in order to learn or create models, that AI, or the promise of big compute, has started to be delivered. Now, we've very quickly moved from a period when the machine could beat the IBM machine, be a Big Blue, could beat the great chess master, and Google's AlphaGo, another AI model, could beat the world's greatest player of Go, which is a highly complicated, multi-layered, intellectually game of strategy, but it's again a board game with novel approaches. And the interesting thing was not just crunching the moves faster, which was true, and smarter, which is true of chess, but actually creatively, that we've now moved to something called uh, generative AI. Now, what exactly is generative AI? What's it generating?
The way I think about generative AI, it's actually producing content in response to a prompt. That's what it's generating. It's generating content. I think about it like a creative writer, or a tool where you give it a prompt and it can give a response. And whereas agentic AI, which is where we're going, is AI where it's an agent that's acting autonomously, and it's like a project manager that's going to orchestrate a lot of different tasks that are going on. It's going to do that for you. But you're right, John, to start with a regular AI, which is impressive, and it is, in fact, I'll go back and say, is an alien intelligence.
No, Dev, stick it up with your Star Trekky sci-fi October Halloween surprise nonsense. Let's. So we've gone from the power of computers growing, nearly exponentially in certain areas, the ability to, and Gen AI being things like Chat GPT, Claude, Gemini, the big tools, Mistral in Europe, that people are using. And a prompt is simply a targeted, attuned question and context that then allows the machine to come back with content. A lot of people, Grok would be another example, and there's a massive battle among the big tech titans to build the biggest and the most expensive models, and these valuations are going through the roof. And NVIDIA creates the chips and all that. We don't need to get into how it happens, but Gen AI is something that has grown faster than any other software tool or perhaps consumer tool ever in American history. It's growing 400 times, I think, as fast as search grew. So it's a big deal because even in some cases, it's being integrated into business. It's everywhere being integrated into white collar work. And now and that is to your point, you create this targeted series of questions and context called a prompt. And now we're moving to agentic AI. So this is where the robots take your job, David. I mean, what is agent? What kind of agents are we talking about?
Yeah, they could take my volunteer job of trying to arrange all sorts of nonsense in the world. Oh, it's where they act sort of on my behalf. So they're going to go out and instead of say me going to a website and setting something up or searching for something something to shop for and then buy it and approve it and decide where it's going to go, it could theoretically do all of that for me. So you're seeing applications in places like shopping. And I think, yeah, you can see how that could work. And there's earlier versions of that. You can imagine picking out your airline and your hotel
But
and all
but
that.
but
But
Dave, what's different? I mean, people have had shopping bots that are working
yeah,
either for shoppers when you're on a retail site, or the retail site is using it to respond to giving you the next most likely thing to buy,
yeah,
suggesting the next model, next movie for you to watch. What's different about agentic AI and effectively the kinds of things that Netflix and Amazon is already doing, which has some form of large compute and intelligence
yeah.
associated with it.
So like a lot of these things, the dividing lines aren't so crystal clear. But in general, the bots that you have now are more like the chat bots. So like ChatGPT, similar idea. I can ask it, it can tell me, it can suggest this and that. This is more, I'm going to say, John, would you mind going out and just like booking this trip for me? Like think about like a travel agent. I don't say to the travel agent, hey, what's this? What's that? I say, I need to go here. You know my preferences in general. Go and book it and send me the itinerary. It's more like that.
Well, and I would go even further, David. Now let's shift into healthcare. I'm on the board of an agentic AI company, and the agents, if you will, have the ability, the computer generated agents that can interact directly with providers, doctors, nurses, et cetera, and patients to answer complex benefit coverage and design questions, conditions about that can go with certain drugs, the drugs and fulfillment. And so effectively, we're taking some of the roles that would have been handled by call centers, if you will, and hubs for pharmacy, and really turning them into agentic AI engines that are 7/24 available, that have complete information, that can be completely updated. And in many cases, the bots appear to be as sympathetic or more than the people who otherwise would be handling and parsing through all the bureaucratic nonsense that really sits in the middle of people people needing care and people getting care. And so I think this agentic AI, when you can actually set up an interactive computer interface that's got some intelligence associated with it, we may actually be able to use these things if we're careful, because it's healthcare we're talking about, to simplify and and accelerate people's access to care. But that's the positive case. David, this is healthcare. What could possibly go wrong?
Well, in your previous question about whether it's going to take my job, and I know it's not that you were joking, you're just looking for something to stick me with, which is fair. That's part of the rules of engagement here. But what AI is doing at this stage is actually taking the jobs of some of the people in the outsourced call centers, let's say in the Philippines or in India, that can handle the basic questions. Now, as we've been discussing before, I'm in the process of helping my parents who are in their 80s to make a move, and there's a bunch of things that have to be done with healthcare. And my experience of being on the phone, you'll talk to a person, say an agent, and then they invariably have to check with their supervisor, the next level of support. You get handed off in a lot of places. So what I'm now thinking about is, this agentic AI, maybe it's that first level. before they say, hey, I have to check with my supervisor because, you aren't authorized to talk about your father unless we do that. Or they're also moving and not just changing plans. The main processes can't seem to handle that today without a lot of heavy human interaction and sometimes has errors. So I think what's going to happen is we're going to start with the bot is going to be almost more like dealing with that entry level piece. Now, maybe you could flip it around and say, actually, no, the entry level is going to stay as the person, but the agentic part is going to be dealing with all those supervisory requirements. Maybe it goes that direction. I'm not exactly sure.
But I think what you're pointing out is that there are a lot of breakdowns in the current customer facing applications to access choice, visits, bills, follow up, changes that at least theoretically the agentic AI should be able to replace completely because it's got much better information and it can perform with incredible consistency if it's programmed correctly to constantly be upgraded and updated to get the patients the access to the care they need. And by the way, when they're available, it's not held to any human schedule.
Yeah.
But
Yeah.
again, I go back, Dave, to what could go wrong?
Right. Well, I was actually going to go the other way, John, and say what could go right. What would you like to see? Because I think we can. I was just thinking we can very quickly get into why this isn't going to work. What are some things we would like to see happen? And one of the things is that when you have an interaction with a healthcare system, it's a lot of times because you're sick or somebody you're helping is sick, you're under stress, you don't want to deal with a lot of new administrative issues. So what are some things we might like? Well, one issue is that after you're coming out of the hospital from a discharge, make sure you get to the right doctors, make sure that your prescriptions are filled, make sure someone's going to come and see you. I'd like to see those sort of things done. That would be one kind of use case that I think would be good. Another one we talk about sometimes is, gaps in care that get flagged, which means basically, hey, somebody's not getting what they need. And as a result, they're probably going to end up in the emergency room. We want to actually identify those things and intervene earlier. Those are a couple places that I would love to see these agents actually take over for me. And I know what I want. I want to come out of the hospital. I want to get my appointments. I want to get my medications. I want to get my follow up, and I want to deal with the insurance. So I mean, those are some things that I would like. Now, I will answer your question. What could go wrong? So here's one thing that could go wrong, John. I saw a headline about this the other day. Um, my AI agent just got phished, right? So you know, not it was a headline. It wasn't an email to me, but there's things like that can go wrong in healthcare or not.
Well, I think, Dave, the reality is anything can go, but we have a system right now that's kind of lousy for consumers to access. It's hard for doctors to kind of do their work. And there's a lot of just friction in the process. And I still think we're dealing with the long tail of people working incredibly hard during the COVID crisis and not getting a break. I mean, we will be hundreds of thousands of clinicians short over the next decade or so in terms of hospitals and nurses. We hopefully won't continue to tighten the access for foreign medical professionals to come to the United States, but that's a real challenge. One of the few areas of, I think, white space and hope is that we can leverage tools like agentic AI to replace humans and I honestly make doctors and nurses, social workers and psychiatrists and psychologists jobs easier, as well as the administrators of all these hospitals and doctors' offices. I mean, I'm actually quite, um, quite optimistic that the power of having seen that, through our own deployment of agentic AI with complex call centers. I think we could do that for call centers in health plans. We could do it for doctors' offices. And just the explosion in ambient listening, where it's called Scribes, where everyone from Epic to some early stage startups is build and OpenAI are building tools where the doctor no longer has to be pit-pattering entering lots of data into the Epic EMR. They can actually make eye contact and listen to the patient, and then the ambient scribe, the agentic scribe that's listening to that patient interview and patient interaction, can code that in ways that would identify the next most important action and also autonomously code it into what should be more likely to be an accurate and complete bill, which is to sort of shift the responsibility of the doctor and the nurse from generating the perfect bill to perhaps generating the perfect care.
John, a lot of the things we've been talking about here are, administrative in nature. Either it's things that are being done in their essence, like an enrollment with non-clinical staff, administrative staff, or a bunch of administrative things that clinical people have to do. And I see opportunities there. My concern is that the processes aren't robust enough. That then if the AI goes in there, it may cause new problems. But I do see a lot of opportunity if that can be done well. What about on the clinical side? So actually getting, better care, or getting it faster.
I think if you think about the fact that you've got this brain, this clinical brain, that is pulling in all of this information. It typically takes about 15 to 17 years between the time that doctors, the academies, the most important authorities in medicine agree on an advancement of care or a novel therapy or therapeutic to the time it's actually deployed consistently in the places where it should be. That should go to almost zero once you've got agentic AI partnering with the human in the loop, the doctors, to actually upgrade that care. I think we should be able to develop a therapeutic intelligence layer that could really make care coordination and care enhancement and what the more consistent and more intelligent and hopefully lead to better care faster.
Let's talk about maybe from a primary care physician, how this might change their world and what they do. So now, patient comes in and they discuss things with their physician. The physician may be able to handle it themselves, or they may make a referral. If they make a referral, they do it based on who they know or who's in network and things like that. But maybe if you think about it differently and you considered empowering primary care with an AI agent, that they have a problem and they could go out and say, find me the best specialist that could actually work on this. And actually don't just refer the patient to the specialist, let them go through the friction of getting the authorization to see the patient, to see that physician and then getting the appointment and so on. But more physician to physician interaction with an agent. We take it the other way too and say those specialists that have a lot of knowledge. Some of them may have written textbooks, they've written articles, could actually create even avatars of themselves that start with what they know. And then the avatars may be able to interact, that those may be agents actually, and they may be able to interact.
You don't have to go to again, your sci-fi movies to say, look, there's going to be intelligence at your fingertips and effectively an intelligent companion that's going to help support the decisions. I mean, healthcare is super complicated and people are super fragile. And then you get to billing, reimbursement, formularies, protocols. So you've got three real levels of complexity. If the doctor can just primarily focus on the patient and not the billing, and be as intelligent as they possibly can be. Also, nurses and social workers and psychiatrists, everybody, I think that's a big boon for the patients. Now, I still think that to your point, the every technology is fragile, and we need to harden them to protect them from cyber. And when you're doing a novel technology, it can definitely the technical world is literally hallucinate, and believe me, they do. The other day, we were playing around with ChatGPT, which is one of the larger agentic models, perhaps the most advanced one in terms of compute. And it was arguing with us as to whether the East Wing had actually been demolished and whether there was a ballroom being built. So it can really these models are built on vast amounts, largely of internet informed information, and sometimes the signals can cross, as they do with people, but remarkably factually wrong. So I still think we're at the level of anything in healthcare has to be held to a higher standard. But gosh, if you were to pick an area of work where you need more intelligence, healthcare, which is full of administrative costs that need to go away, healthcare, and where it is really where we don't have enough labor to cover the people, I think that I think healthcare is prone to be one of the best areas. Now, Dave, you haven't really been willing to take the bait on what can go wrong.
Okay, I'll try. You know, if they take the bait, John, that like it's not a criticism of the
Okay,
person. They
okay. Well,
didn't take the
I
bait.
thought you'd done all the research, but I read a really interesting piece of research
Yeah.
that one of the things that one of the
Oh, John,
places where
I was just about to take the bait, but you go
okay,
ahead.
go for it. No, go for it.
Here's what I'm worried about, John. So, healthcare, you ticked off all the reasons why it's a really good candidate for agentic AI, and I agree. Now, here's the issue, though, as you talked about coming out of the pandemic. One of the things that's very important for healthcare and that's been lost to a great degree is trust. If people don't trust the system, they don't even trust their own doctor anymore, or the pharmacists, and never mind politicians or people running the healthcare systems. So, to me, it seems that if we could actually and it seems to me, all else being equal, that introduction of AI is going to reduce trust. So if we could flip it around somehow and find a way to have it increase trust, I think that would be very powerful and really the only way it's going to be successful in healthcare.
It's a really powerful point, Dave, because without trust, you're going to lose patient follow up and follow through. If you don't have that, then honestly, AI is a problem. The other interesting problem that's emerging, and it's a fear of a number of people in medical schools, is does the AI itself make us dumber because we no longer can't do calculations by hand. We don't longer write because we let the AI write. Well, there was an interesting study of doctors, I believe it was GI doctors, and the study was okay. If you have doctors, how well do they do in diagnosis? Test. Okay, they do well. How well do the doctors do with diagnosis assisted by ChatGPT? I believe ChatGPT could have been another agentic AI partner. They were better. But when they took after having trained them on how to use AI, it took the AI tools away, the doctor's skills were worse after working with the AI. Now it's a small study. It's indicative more of a question than a conclusion. But one of the other interesting things is, we rely on discernment, judgment, the accumulation of a lot of knowledge for the best and most complex diagnoses that we all want to have access to. We assume that the tools of technology would help that. Well, it definitely helps around innovation and esoteric research. But we really have to somehow find a way to design it that in addition to lowering costs and helping workflow, we actually make sure that the doctors and the diagnosticians and the psychiatrists and the social workers all become more intelligent, not less, when we put these tools in. Because if you think about where trust is going to fail, is if people start to note that an office without your bots, your holograms, your avatars, and your ambient David Williams is not doing as well as the ones with just Dr. Weber or whatever.
So, John, I know you accused me of being a sci-fi guy, which I'm really not, but I think a very interesting question is whether AI is just like another tool in technology or whether it's something fundamentally different. So let's go forward with your discussion there about the physicians and the de-skilling, which I do worry about. So if you talk to these old school physicians, and I'm talking physicians that are like 60 plus, that
Old
were
people like
trained to
us.
palpitate, well, they're trained to lay hands on, listen to the patient, listen to the chest, stethoscope, and so on. What they will often say is about their younger colleagues, they don't actually know how to do that because they take the image, right? They just go do the MRI, the ultrasound, whatever it may be, and so they don't have that skill. And so, and there's different reasons for that, including incentives in the healthcare system, which is I can get paid to do an MRI. I'm going to go out of business if I just listen to your chest. But put that aside and say there's already kind of that trend. Now, is the AI doing the diagnosis just one more step like that, which we can deal with, or is it something fundamentally different? And in terms of how it's going to grow and change, what are we looking at in 20, 25 years? What is a physician? Is it better actually just to have a lesser trained person, let's say a nurse, social worker, or whatever, who's able to interact in person with a patient and then use the intelligence, from the system to do everything that those physicians could do before and maybe do it better? Or are we saying somebody who's like a brilliant neurologist or GI now, Are they going to be empowered somehow and be like really, really good or not? To me, I don't know. I worry more
Well,
goes in the
I
destilling area.
think that what you really are, and this is probably a good place to wrap because we will be digging into this with practitioners, with people who understand AI, is if you reset, if you say there's sort of a pre-AI era, an era where people were dealing with with knowledge, training, and care in one world, and we've really reached an inflection point that care is now different. We should re-underwrite intellectually and clinically how we're going to actually architect care. Because otherwise, you run the risk of assuming the machine is better or worse, the doctor is better or worse, and the things are going to work like they did before, when really, if it's really truly novel, everything may have changed. And I think, well, certain areas like the law, which is very rules driven, you can see an absolute replacement. Call center, you could absolutely see full replacement. Healthcare, I think we really want to step back and say, what does all of this mean? And how do we think about the architecture of everything from the training of a doctor and a nurse to the care of a complex elderly patient to how we do drug treatment protocol and clearing insurance in a way that we actually test whether we're getting something better, worse, or different, and different that we have to then model differently or architect differently.
That's it for yet another episode of CareTalk. We've been discussing the rise of agentic AI and all AI and how quickly and broadly it will change our world. I'm David Williams, president of Health Business Group.
And I'm John Driscoll, the chairman of the UConn Health System. If you liked what you heard or you didn't, we'd love you to subscribe on your favorite service.